Senator Samra Brouk, thanks so much for being here.
Thank you for having me.
Of course. So you want to do something, it's a unique idea. It's basically a 3-digit number that people could call when they're experiencing a mental health crisis. Kind of similar, think of 911, but this would be 988. So let's start with, tell me what kind of calls would be going into this number if it happens. Are these just strictly mental health emergencies? Are these just people looking for help? Who would it cover?
Yeah, that's a great question. And I think that the way you laid it out there is correct. Right now, we have really overburdened the 911 system with essentially anytime someone has anything remotely urgent or sort of emergency situations. So the real idea behind 988 is that we want this parallel system. So you've got your 911 system for medical or fire or police emergencies, and we want that same thing, 988, for any sort of mental health or substance abuse emergencies. And so what I might liken it to is, right now we have this national suicide prevention lifeline, where if someone is feeling suicidal or they're feeling like they're in some sort of crisis, they can call it, but it's this long 1-800 number. And so the point of 988, especially here in New York State, is that it's an easy to remember number that if you are having those suicidal thoughts, or perhaps you're feeling just in a moment of crisis and you know that you need help. That's a number that you can call that you'll actually be able to get paired with trained mental health counselors and providers to help you get what we would call this kind of red hot moment of crisis to a cool moment where you're able to move on with your day and or get the services that you need to get better.
So is it just the people that you would be calling on the line? Is it just those trained counselors, or is there an opportunity for first responders to become involved as well?
Definitely. So right now, and to just move backwards for a moment, this is all part of a federal act that was signed into a law last October. And the federal act said that every state needed to adopt this 988 number, and that the 988 number had to go towards this suicide prevention line, so that in every state, folks had someone to call, somewhere to call for a mental health crisis or a substance abuse crisis. So not only will there be trained counselors answering these calls, as there is now with the National Suicide Prevention Lifeline, but we're also looking to make investments in what we call mobile crisis teams, which do become these first responders to be able to answer a call where perhaps someone does need someone to come to them and help them with whatever it is that they're going through. But the key is right now, there is no emergency line statewide for someone to call when they're in a crisis like that. So the first step would be making sure that we get this 988 infrastructure set up and that we have people to manage and answer these calls.
So since it's part of a federal program, is the federal government funding it, or does the state have to come up with the money? I guess, how would this be funded? Because I know that counties often have concerns about what they call unfunded mandates from the state, where they have to provide a service, but not necessarily the funding to do it.
Yeah, so the whole point of actually having this act where the states themselves are responsible for setting up 988 is that we really are going to run it just like the 911 program. And I do want to dig in that for a moment, because I think it's really important to outline that we have substantially withheld funding, decreased funding to a lot of mental health services over the past several decades in this state, but then also on a federal level as well. We have simply, missed the mark of understanding that mental health care is health care, that mental health is just as important as physical health. So what 988 does is it creates that entire infrastructure, and we plan on funding it similar to how we fund 911, where it's a small amount that most of us probably don't notice that pays for 911, and we'll use a similar amount on wireless carriers, or sorry, folks with wireless phones, and it'll be just like the 911, but this is be the 988 trust fund that actually gets used for managing the 988, building the infrastructure, making sure we have people to answer those calls here in New York State.
So it seems like this really complements a part of the state budget, which set up what's called crisis stabilization centers, which are essentially these facilities that people would be able to go to if they're experiencing a mental health crisis or a substance use crisis. How do you think they'll work together? Do we see these mobile response teams going to people and bringing them to these stabilization centers? And on that note, do we see law enforcement kind of being removed from that equation?
Well, yes, so there's a lot to answer there, and I think it's absolutely right. When, if we step back a step, and we talked a lot about this when we passed the budget, specifically the mental health budget that I oversaw, and we really started talking more about how are we going to tackle this challenge. And I think it's important to understand that there was already, a mental health crisis here in New York State. COVID-19 pandemic, the isolation, the anxiety, the depression that came with it, the removal of your normal routines, especially for young folks, has all exacerbated the mental health crisis in this state. So the crisis stabilization centers, I would akin to something like an urgent care, but for mental health. So the New York State budget does allow for now the study of crisis stabilization centers and really putting together a plan for what that could look like across the state. It will look different, for example, if you live in Brooklyn than if you live up here in Rochester or in perhaps some of the rural areas of New York State. And that's exactly what we're working with OMH to do now, is really figure out what does this crisis stabilization center model look like, and how can we learn from centers that exist today. For example, there's one in Dutchess County that operates. It allows for detoxification if necessary. It allows for a place for someone to go who might be in crisis. And what it does is it gives them care as opposed to meeting them with any sort of punitive and violent measures, which, as we've seen, has happened time and again when someone is in a mental health crisis and is met with law enforcement versus the type of mental health providers that they need.
All right, we'll keep an eye on it. Senate Mental Health Chair Samra Baruch, thank you so much.
Thank you.